All right, so today I'm going to talk about 3 warning signs that your knee is probably in some serious trouble, because this is something that I encounter a lot in my practice as a non-surgical orthopedic doc. Is people come dragging a knee in, literally, that's been hurting them for a long time, and if they would have known some of the warning signs earlier in the process, we'd probably have a less significant thing to treat over here once they do show up in my office. So talking to the people out there that like to ignore their knee pain today, and why maybe you won't want to in the future. So knee pain shows up. Okay, we've all been there, strained our knee, had an injury. It recovers, it bounces back over a few days, and back you go. Back to the thing you love doing. But what happens when it doesn't? So the pain lingers. Now you're out playing it on again. You're trying to play through the pain, kind of the old dogma of no pain, no gain. You just play right through it, right? So what is happening under the surface when we have pain is that chemically, that tissue is emitting chemicals, right? Then those signals go upstairs to your brain and tell you got an issue there. So we have 2 paths there. We can ignore the pain and play through it. Okay, everybody's been there. I've been there as a stubborn athlete and done that. But what happens when you kind of register what the pain's telling you, which is trying to get you to give that injury a little bit of time and space to heal? Then we can get after it. So if we don't do that and we push through the pain, then what some people start experiencing is the first warning sign. Now you're getting swelling in your knee. So what is swelling in the knee when it shows up is that typically you're injuring something in or around the knee that triggers the lining of the joint to produce more fluid so that it stiffens your knee, intentionally to give you the time and space you need to try to shut you down so the thing can heal. So again, if you keep ignoring it and it keeps swelling, that is a very good marker of underlying tissue damage that's probably getting worse. Okay, so that's warning sign number 1, swelling in the knee. Warning sign number 2, so now you're not even being active. Okay, this isn't in the context of playing golf, playing pickleball, riding your bike, hiking, whatever you're doing, where you might be feeling the aching pain, you might be getting some swelling in that activity, so now you're not even active. And this is where I want to talk about night pain. So when you go to bed and you're trying to sleep and your knee is aching, why does it ache? Okay, that same chemistry has been just circulating in the knee joint, but as you move, as you flex a knee, we'll take this knee model, as you flex your knee and you move throughout the day, you're actually moving that fluid, you're moving some of that chemical, environment around inside the joint, and it's less painful because of that usually. As somebody told me back in my training, motion is lotion. So when we're moving and we're active, number 1, we're somewhat distracted because we're in an activity doing something, so we're not paying complete attention to that knee. And what happens when you go to bed? Man, you're paying complete attention to that knee, especially when it's aching, especially when it's swollen. But what happens is when the knee sits there statically at night, you are not moving any of that fluid around, and these surfaces inside the knee joint could contact and come to rest on one another. And just like biting down on a tooth that has a crack in it, that pressure stimulates pain. Right? So even when you're sleeping, your body's still registering what's going on at the tissue level, okay? So if you're not able to move throughout the night, your body is going to wake you up and move you during the night because of that contact, because of that chemistry. So second warning sign would really be night pain, okay? And the third thing that I see often in the too late stage for people is they come in and their knee doesn't move like it used to. What do I mean by that? They're telling me they feel like they've lost motion in one knee compared to the other. So now if we've let that injury go for a long period of time, you're getting all the signals during activity. Now you're getting swelling. Now you're getting night pain. Now you get to a point where your knee does not like to bend like it used to. Now, one of the reasons, like a gentleman I saw this week in the office, why his knee couldn't bend all the way was because of that swelling. So when you have that fluid inside the knee, you really can't bend that knee and flex it over all that fluid. It's like you have a water balloon inside your knee. And in his case, we drain that fluid out. Now, it's not going to fix the root cause of the problem, but it's going to help him get on his way towards what else we're building around his treatment plan. But if we have the persistent pain, swelling, night pain, now we get to this stage where that knee is really starting to break down for a lot of people. And what we're breaking down is the cartilage, maybe we're breaking down the meniscus inside the knee, and what we'll start to get is a reduction in the range of motion. So now they can't get it fully straight, they can't flex that knee all the way, and for some people the knee will start to angulate where they're looking at themselves and the knee starts to bow or get knock-kneed, And that's a late stage finding for people. And typically at that point, it's arthritic. It's getting probably close to that bone-on-bone stage, and it's almost a too late stage for me in my practice as a non-surgical orthopedic doc. So the 3 warning signs to recap, okay? Swelling in the knee, night pain, and reduced range of motion in your knee. If you have the inkling of any of those symptoms that are persistent, then I implore you to see somebody sooner than later that can help you diagnose what is that underlying problem that's hanging up your knee, giving you that pain, giving you that swelling, giving you that night pain, and let's get to that before it gets to that state where it's in a decreased range of motion, your knee's angulated or too far gone to really do anything but surgery, because most people that come seek me out want to avoid surgery, and that's what I do in my practice. So hopefully those 3 warning signs are going to help some of you out there. If this helped you in any way, like the video, subscribe for future content like this, drop comments below, and my team or myself will try to answer as many as we can.